So we're here at ISNTD Coinfections and Comorbidities. We have here with us Peter Jourdan from the entity DeWorm3. I just wanted to kind of start, Peter, you've just given a really good presentation in terms of the afternoon session here. And, I just wanted to ask you a few questions. We've tracked the SCI for the last 4 or 5 years in terms of their work. We've also had the pleasure of having people like Professor David Rawlinson, speak from the Natural History Museum on schisto, as well as hybridized schistosomes from people like Bonnie Webster as an example. What's the evolution of DeWorm3 all about? What are you and what are you doing?
So yeah, I think this is very much adding to the previous efforts that have been done in NTD control and elimination. This is a new investment by the Bill and Melinda Gates Foundation, which is based at the Natural History Museum in London and with support from the University of Washington in Seattle. And it's very much looking to provide high quality and rigorous data on the feasibility of eliminating not schistosomiasis, as has been the focus previously for a lot of the funding, but now for soil-transmitted helminth infections or intestinal worms. So it's very much a large-scale effort at providing rigorous evidence for STH elimination.
And this would be rigorous evidence from mass drug administration programs or from molecular biology? Which side of the spectrum are we talking about?
So it will be more from the programmatic side, but I guess it's a bit in between. So these will be randomized controlled trials in a trial setting, but could potentially include ministries of health and education that are implementing the MDA, but we will be studying the effects of that in a trial setting. So we'll be collaborating with a number of partners in countries, which can include ministries, to conduct these trials. But our first priority is to conduct high quality trials, and then the second stage will be to take those results from those trials and then provide recommendations for operational programs, policies. Exactly.
Well, that's fantastic. And it sounds like a very much needed step in terms of the what we've heard from this morning, the nuances involved in MDAs and the various rollout programs that are out there. In terms of partnerships, I know you have people like Judd Walson from Washington in terms of the structure at DeWorm. So there's already, and you mentioned the Bill and Melinda Gates Foundation. So there's obviously a cross-Atlantic kind of axis there building. What type of partnerships would you be looking to make to further DeWorm3 in its particular effort?
Yeah, so we've already had a number of applications in terms of partnerships for rolling or for conducting the trials. So they were looking at research institutions and other partners that are capable and have experience in conducting RCTs, in addition to those partners that are responsible for MDA, so ministries of health and education and so on. In addition, we are working with a number of support units. So we're working with experts in various fields, for example, in determining the definition of interrupting STH transmission with Imperial College and experts on mathematical modeling there. We will also be working with other support units of experts. London School of Hygiene and Tropical Medicine is a candidate, for example. So we're working with a number of partners in various fields to analyze various components that can affect the elimination of STH.
Okay, and from a country perspective, what would be the countries that you're going to be engaging with first in terms of the actual trials and the...
So from the applications we had, which was a highly competitive process, we have shortlisted 6. We are looking at selecting in the first instance 2 main sites in Africa and 1 site in Asia. So for the time being, and as you can see on our website, we will be visiting India and Sri Lanka as 2 Asian countries, and then we will be having Malawi, Ivory Coast, Cameroon and Benin as the 4 shortlisted countries in Africa.
And may I ask you, Peter, what was the criteria for the shortlist? What were the factors that were pushing those locations forward for the program?
Sure. So that was a whole process where we first had an external review of external experts people with a strong experience in conducting RCTs and in programming and in NTDs, etc. So that was a whole independent review that fed into an internal review now of the applicants, and according to the requests for capacities, such as institutional research capacities, laboratory capacities, and so on, in addition to the epidemiological and geographical context, all of that was put together to determine the shortlisted partners.
Fantastic. And you're ready for rollout now, or you're ready for rollout in a few months? You're there now in field?
So we still have to make the final selection of the sites, which will happen within the next few months. And as soon as that is in place, we'll be working through all the administrative processes that are needed, also in terms of ethical approval and so on and so forth, to be able to roll out these trials, which we hope will be rolled out in the beginning of 2017 at the latest.
From a progress through partnership perspective, right, you're here today, you've got quite a diverse range, from people like MTV to Merck to, J&J to various technical, quite a diverse range of people speaking and participating.
First of all, I think we very much appreciate the fact that ISNTD have brought together so many different partners. Obviously, what we will have to ensure is that the investment that has been put into this project will make sure that we get the kind of evidence that we are looking for. So we're looking for partners that can build up and help support the provision of the evidence through RCTs. And we're happy to communicate with any partners that could be potential partners.
Peter, I'd like to say thank you very, very much for making time to present and to participate and for this very brief interview. Wish you all the best, the very best with your work, and I'm sure we'll cross paths again.
Thank you. It's been a pleasure.
Thank you very much.